Restoration Church. My name is Diana O'Reilly. I'm a physician assistant or PA. I work in a local hospital here in Huntsville. Today I'm here to talk about what to do if you've been exposed to someone that has a positive coronavirus test, and what to expect as well, okay? So all this information that I'm providing today is from the Alabama Department of Public Health. So what they recommend is just to monitor your symptoms and stay home to spread that disease to others. As we all know, COVID-19 is a respiratory disease. It's caused by a new virus, the SARS-CoV-2, and most of the symptoms is shortness of breath, fever, cough. A lot of these patients, they develop a mild disease, which people can stay at home, but there are other population that develop the severe disease and they have to be hospitalized. So how do you know you've been exposed to someone that has a positive COVID-19? So you have to have a close contact with a person that's sick. And close contact means like you're living with this person. Like if this person, if they say, okay, you have COVID-19 and you're in the same house, or you caring for a person that's sick with the COVID-19. Also, if you are in contact, close proximity, which is within 6 feet of that person, or you're in contact with with respiratory secretion, which is that person sneeze, cough, that's all considered, close contact. So what to do if you're with someone that have confirmed COVID-19, but you're not sick and you're not having any symptoms, right? So the Alabama Department of Public Health is advising to self-isolate. For 14 days, you have to make sure you don't develop any symptoms, okay? And of course, the symptoms, like we say, the shortness of breath, the fever, the coughing. You cannot go to work and don't go to public places as well. But if you were not in contact with a person, if you were not very close to them, like I said before, that's being within 6 feet, being in that area within 15 minutes, your symptoms of having the disease is very low. So then after you kind of monitor your health and you're okay, you don't have any symptoms, it's okay for you to go to work. As well, they're recommending so what about if you're in contact with somebody and you do get sick, right? So if you have the symptoms, most likely that you are gonna have COVID-19 and you were in contact with this person. You have to stay at home, quarantine yourself for 14 days. But if you have conditions such as you're older than 60 years old, you have medical problems like diabetes, heart problems, lung problems, if you're immunocompromised, you have HIV, sickle cell patient, pregnant, then you have to contact your doctor. When you contact your doctor, they can monitor you more closely, and then they can decide if you have to come in for testing. But as well, like if you don't have all these all these conditions, you can also call your doctor just to make sure, just so they can check on you and you together with your doctor can decide if you have to come in for evaluation. So remember, if you have a medical emergency, which is difficulty breathing, chest pain, high fever, if you become lethargic, confused, if you develop discoloration in your face, around your lips, you have to call 911. When you call 911, tell the dispatcher that you possibly were exposed to COVID-19. And when the EMS arrive there, the ambulance, if you can put a face mask, that way you also can protect them and go to the emergency department. So if, let's say you were sick, and when can you stop your home isolation? So it's recommended that at least 7 days have passed after the first symptoms appear. And you have to be 3 days without a fever. And of course, improvement of respiratory symptoms, which is the cough, the fever, the shortness of breath. Now since I work in the emergency department, it is very chaotic right now. It's a lot of people that is going there, so we're very busy. We're taking care of these very high people. Please go to the Alabama Department of Public Health if you think you need testing. around the city. In Huntsville, there's like different areas where you can go and get the test. One of them is the Huntsville Hospital Fever and Flu Clinic. They're located on 120 Governor Street in Huntsville. I'm sorry. There's a testing criteria to go and get, have this test done. You have to have symptoms, number one. And the symptoms include you have to have a fever or shortness of breath or a cough. If you have any of these symptoms, as well, if you're a healthcare provider or you're in close contact with somebody that works in the healthcare provider, let's say you live with somebody that works in the medical field, then you're at risk and you can have that test done. If you have any recent hospitalizations, that's well will qualify you to have the test. If you are a high-risk patient, which means you're pregnant, you're immunocompromised, and you have heart problems, lung problems, kidney problems, then they'll do the testing as well if you're more than 65 or older, or if you're taking care of a person that is 65 or older as well. If you also been in contact with somebody that have a confirmed COVID-19 disease and you were in contact with them and you were exposed to the secretions, also qualify you for the test. High-risk travels, which means in the past 2 weeks you've been to Europe, Asia, or domestic high-risk areas, or as well as clinical direction, like if whoever you see there, the doctor, the nurse practitioner, the PA, and if they think that it's okay to do the testing, then they'll do it for you. Also, I want to remind you to continue to wash your hands, maintain social distance, stay at home if you have any mild symptoms. And I want to ask for a special request. As everybody knows, we're very short on N95 masks. And so these are commercial masks. My husband, he actually had it in the garage. People use it for like painting or construction, things like that. If you have any of these masks, please donate it. You can bring it here or donate it to the hospital because we truly need them. They're lifesavers. Also, please pray for your healthcare workers, for your first responders, for your nurses, for your PAs, your nurse practitioners, your doctors. Anybody that's at the front line, pray for them. Be nice. This is a very difficult time, but we have to be kind to each other. Pick up the phone, call your neighbors, call your friends, especially older people that are isolated right now. Give them a call, make sure they're okay, pray with them. God is amazing and He is with us every step of the way. And I know we all get through this. We just have to be so kind to each other and pray. Thank you.